What happens to your body when you stop smoking?
Just 20 minutes after you have your last cigarette, your pulse and blood pressure will start to reduce. Within around 8 hours, the amount of oxygen in your blood returns to normal. In the same amount of time, the amount of carbon monoxide in your blood will be reduced by half. By the second day, it will be gone completely. After about 2 days, your sense of taste will start to get better. As early as 2 weeks after you stop, your circulation starts to improve. After 1 month, your complexion may improve, and any wrinkles might be reduced. You might notice you cough less and that your breathing improves. Between 3 and 9 months after quitting, your lung function can increase by up to 10%. By the end of the first year, your risk of a heart attack will drop by half. After 10 years of not smoking, your risk of lung cancer goes down to half that of a smoker. Your risk of getting other cancers, like mouth, throat, esophageal, bladder, and pancreatic cancer, also all decrease. After 15 years of not smoking, your risk of having a heart attack is the same as someone who never smoked. And it's not just your physical health that can benefit. Stopping smoking may also improve your mental health. Giving up smoking is associated with having a more positive mood, as well as feeling less stressed and less anxious.